Hello, everyone, and a very warm welcome to today's ISESA's webinar session. Before we begin, I'd like to remind you that registration is now open for our ISESA's inaugural conference, taking place at SETU Waterford on the 22nd and 23rd of May. Mega kudos to the conference committee. The programme looks superb, featuring fantastic lineup of speakers, and there really is something for everyone. So I do encourage you to register and to go to that conference. As part of the conference, we're also hosting the All Ireland Postgraduate Conference. The deadline for abstract submission is midnight of the 14th of March. And if you require any further details in relation to the conference or any events that we're hosting, participating in, please check out our website at www.isesa.ie. Now, on to today's guest speaker, Professor Kate Pumpa. Having met Kate at the recent launch of MEDA in the beautiful setting in Glastonhouse in January, I quickly learned that Kate wears many hats. Kate is a distinguished figure in the field of sport and exercise physiology and currently serving as a full professor at UCD. She is an accredited exercise physiologist through Exercise and Sport Science Australia, and she has extensive experience in clinical practice and has worked at the highest levels of high performance sport as a dietitian. And trust me, I could go on. Today, we are delighted that she is joining us wearing her ISESA director hat, in which she's going to talk to us about the process of applying for a sports science accreditation. Before I hand over to Kate, can I just remind the audience if you can submit your questions in the Q&A box, and at that, over to you, Kate.
Thanks very much, Carla, and welcome everyone to this lunchtime webinar on how to attain sports science accreditation. As Carla mentioned, I am currently sitting on the board of ISESA and chairing the Accreditation Committee. So why should you seek sports science accreditation? I've listed just some of the really important things I think into why accreditation is important. And quality is probably the number one. It just ensures a high academic and professional standards. If you are accredited with ISESA, then as you'll see, professional qualifications are really important. And if you hold that badge, then it will be recognised that you have a high degree of education and experience. It's also a sign of credibility to potential employers, maybe your clients, fellow athletes, and also your peers, that you have training and experience that aligns with industry standards that ISESA and previously Sport Ireland are setting. We hope that it provides you a high level of recognition and also employability. So, for example, to work at the Sports Ireland Institute, it is a requirement to be accredited as a sports scientist with ISESA. And we know that employers do value accredited qualifications as they do guarantee that certain level of knowledge and also qualification experience. From a broader perspective, accreditation does enable the public to, I guess, trust the practitioner that they're working with, that they're also a safe practitioner. So to an athlete, being accredited is a sign that you are well trained, you can work really effectively with athletes, and you also understand the nuances of working within high performance sport. Being accredited also requires continuous improvement, and I'll talk about our professional development pathways towards the end of this webinar. But we do have professional development programs that are in place, so we are continually driving to improve the currency of our knowledge and practice, so that if you're retaining your sports science accreditation, then the community, your peers and athletes know that you are maintaining currency and that you're going to be top of your game when you're working with these athletes. And also finally, being an accredited sports scientist with ISESA opens up a whole range of networking and collaborative opportunities for you, so that you're part of a community of professionals that we all share best practice. We want to advance sports science. And through ISESA, as Carla just mentioned, we'll be running lots of different events to encourage you to network and also collaborate across the island of Ireland. So what are the minimum requirements for being accredited as a sports scientist? First off, you need to have a master's or a PhD related to the sport or exercise science discipline that you are seeking accreditation for. So you could be seeking accreditation as a sports scientist with a specialization in sports psychology, strength and conditioning, sports nutrition, performance analysis. There's a whole range of subdisciplines, but you do need to have that higher degree specializing in a particular qualification. You'll also need to be able to demonstrate that you have 200 days or approximately 1,600 hours of work experience within a high performance sport environment or elite sport within the last 5 years. So noting that accreditation as a sports scientist is a higher level of accreditation, and I'll mention the other levels of accreditation that are coming our way towards the end of the webinar as well. So in addition to having a master's in that professional experience, you also need to submit a case study. And this case study needs to provide evidence of your ability to work with elite athletes, demonstrate that you understand and can adhere to ethical codes of conduct and also GDPR requirements, and that you have a capacity to work as part of a high performance team so that you can show you can integrate and work across disciplines, not just within a silo. The other and final requirement that you need as part of attaining accreditation is professional referees. So I'm going to go into these in a little bit more detail. So first off, to demonstrate your experience on the website, in the accreditation tab, you'll find there's a number of different hyperlinks, and I've highlighted the one that has work experience timesheet there. So what you need to do to demonstrate your work experience is to click on this and download the experience template. In here, you'll need to pop your place of work, the type of role that you were participating in or engaging in that particular employment, the start date, the end date, whether it was full-time or part-time, and a total number of days. So if you are working full-time in a high-performance environment, then you might be still continuing in that role. For example, you can pop the start date and then maybe continuing and then where you're up to in terms of days or hours as part of that particular role. It's really important that you complete this template so that when we are assessing, it's very easy for the assessors to identify whether you have met this requirement or not. Probably the most complex, or the place where people may get a little bit more, feel a little more daunted, is the case study. And so the case study is the integral component of this particular accreditation. You need to be able to provide evidence that you have the ability to work with elite athletes. Now, you can include examples of programs or interventions where applicable, depending on your specific discipline. So if you are applying for sports science accreditation as a strength and conditioning coach, for example, you may like to provide some examples of the programming that you've undertaken with a particular athlete. Same goes if you are applying for accreditation as a sports nutritionist. You might provide some examples of meal plans, for example, that you've developed. You need to provide information about the type of support you'd be providing to the elite athlete. Then also demonstrate how you adhere to ethical conduct and also how you respect that athlete's confidentiality when conducting consults or training them. You then also need to highlight that you have the capacity to work as a multidisciplinary high-performance team. Now, we have a maximum of 3,000 words for this case study, which also excludes references. And you do need to include references to showcase your contemporary nature to your practice, and also that you have the ability to identify key sources of information to work with your case study. The other key aspects of your case study is your core principles and values of working in high-performance sport, your involvement working with a particular athlete to solve a specific problem or issue that has arisen, your role in that team, and also the timeline. So it's really important that you can show us, the reviewers, that pick out a particular athlete or a particular team where you have taken over a particular role, and then you followed that particular athlete or team through a series, maybe it's a preseason, or perhaps it's a particular injury or something along those lines, that you can provide a timeline of how you've progressively worked with those particular athletes or athlete to solve a particular problem, not just a one-off snapshot. So I thought to do that, it might be easier to give you a bit of an example of what this might look like in practice. So if you're applying for accreditation as a sports scientist in sports nutrition, you might present something along these lines. So if you're working with an athlete who is injured, you might sit down with that athlete for an initial consult. You might identify their current dietary intake. You might use pre-screening or particular screening tools. So if you're working with a female athlete who you suspect may have low energy availability, you might roll out a Leaf Q, for example. You may assess physique, and that could be through anthropometrics. It might be through a bod pod or DEXA, depending on where you're located. You may also capture some training load data. So that might set the scene for your particular case study. You would then need to provide example and evidence of how you've worked within that multidisciplinary team. So you might be liaising with the physiotherapist or the medical team about the extent of the injury, the time that the athlete might be out of action or on a reduced training load, if they were having any surgery or any other interventions that you would then need to manipulate your nutrition plan for them. You may then also link in with the S&C about the rehab plan that they're providing and how the nutritional intake over their rehab actually changes. And perhaps if it is a really long-term or significant injury, you may also engage that sports psychologist. So you need to show how you've worked within a multidisciplinary team to help that athlete solve a problem or achieve a particular goal. In this same example, you might just describe the intervention. So I might, if I was doing this particular athlete, I would note the first day that I saw them and the types of information that I extracted that from the particular athlete, the goals that the athlete had, and then I would set out some interventions and things that I might be looking for them to improve on over a particular time period. And you'd need to document every time you saw that particular athlete. Say if it was over a 3-month period and you saw that athlete every three weeks or 2 weeks, depending on the time of the intervention, you might provide some notes about what you actually achieved in those particular sessions, what goals that athlete had set in conjunction with you, and what progress they'd made. You might provide some objective outcome data. This might be through physique assessment, for example, or it might be changes in a screening questionnaire if you are looking at that. Perhaps it might be looking at blood work if there's been an athlete who is injured and they maybe have had a really low energy intake, which has affected their iron sufficiency. So you might provide some objective information if you've implemented an iron supplementation plan, for example. And you can also include programs or meal plans within the appendices of that particular case study. So you would need to provide evidence of best practice, and this is where you would reference peer-reviewed literature. So for example, if I was working with an injured athlete and I decided to implement supplementation with collagen, for example, I would be referencing literature that demonstrated if collagen was beneficial for that particular injury. Or you might reference literature that has highlighted increased protein consumption and reduction of other macronutrients for minimizing muscle atrophy during a period of injury. And then again, you need to document that evidence of interaction through other staff and how it's being managed within the team. Finally, at the end, to round off your case study, you also need to do a self-reflection. So what did you do well with that athlete? What things would you do different next time? And how do you feel you developed as a practitioner? Now, all the case studies are reviewed by 3 independent ISESA accredited sports scientists. We will always have 2 from your specific discipline. So if you are submitting accreditation as for a strength and conditioning specialization, then we will have 2 accredited sports scientists who also have strength and conditioning specialization review your assignment and case study, as well as somebody who is external to that particular discipline, however, has knowledge in your particular discipline. When the assessors have reviewed your case study, they then return them to the ISESA administrator who collates the feedback. And the assessment of case studies is all blind, so the reviewers do not know who has submitted the case study and whose case study they are reviewing. The only person who is privy to the name that is attached to a case study is the ISESA administrator. She independently collates all the feedback that's received from the 3 different reviewers and provides those outcomes to the accreditation committee. Now, where we have a discrepancy in recommendations, for example, maybe 2 out of the reviewers have passed the case study, 1 has not passed the case study, we then hold a meeting for the 3 reviewers and the chair of the accreditation committee to discuss and provide a consensus on the outcome of that particular case study. So this is how the case studies are assessed, and you can find all this information on the ISESA website in the accreditation tab. And there is a lot more detail into how these items are assessed as well. But we are looking for the scientific rigor of the work in the case study, so the work that you have undertaken as the practitioner, your ability to show evidence of working within a high-performance environment, having a clear understanding of your role and also the scope of practice. So if you are applying for accreditation as a sports scientist in the area of strength and conditioning and you don't have any nutrition qualifications, that you are not incorporating and providing nutritional recommendations and meal plans for that athlete. So you have a really good and clear understanding of your role, your scope, and how you might be able to work with other practitioners in those instances. and also building rapport and maintaining relationships. So that could be demonstrated over repeat visits with a particular, or consultations with an athlete, or integration with a team, for example. You also are marked on your understanding of working within that high performance team, and the overall assessment will then be provided to you. You will then receive an outcome from an excellent pass all the way down through to a significant fail. And this is based off a marking rubric, as you saw in the previous scores when we add up all the different reviewers, the average of the reviewers' feedback. Now, we do have a more detailed explanation of each of those different descriptors on the website, and also in the professional accreditation guidelines documentation, which can also be found on the website. So recently, we have received permission from 2 accredited sports scientists who have shared their case studies with us as exemplars. And they are available on the website in the accreditation section. So at the moment, there's one from a very successful case study from a sports scientist who had a specialization in sports psychology. And there is also another one that will be going up in regards to physiology, to provide 2 different examples of 2 very different case studies. We have also, once all the reviewers have provided feedback, you will be provided with that feedback. So whether it's from an excellent pass through to that significant fail, you will get the overall feedback as part of your outcome letter. Now, when you're looking for references, you again need to go into the website, and you need to click on the link, which I have highlighted on the screen there, which is using the provided template. You need to provide 3 references. At least one of those references should be comprised of a mentor, and then the additional references could come from a coach, they could come from an athlete or a manager, but someone else. They need to be 3 independent people who you have worked with. And this is on a professional reference rather than a personal reference. So what happens if you do not pass the case study? So if you haven't submitted the appropriate certified qualifications and experience of that 1,600 hours or 200 days, then you won't progress to the review of the case study. So first off, you need to make sure that you meet those mandatory requirements. Once you get through that first part and you've submitted your case study, if it is deemed unsuccessful by the majority of the reviewers, then you need to reapply. So this requires a full resubmission of all the documentation and also the payment as well. So you need to go through the process again. Now, the payment covers the reviewer honorariums, possible meetings, and also administration. So this is definitely not a money-making adventure from the ISESA. We charge the minimum amount that will just cover the costs for these assessments to be managed from an administrative point of view, but also for the reviewers to be paid that honorarium for reviewing your applications. So in terms of them maintaining your accreditation, there is a current continual professional development program in place for the accredited sports sciences, but we will be rolling out some new CPD requirements, which will be launched with the new website as well. And this will require everybody who has gained accreditation as a sports scientist to provide evidence of continuing professional development on an annual basis. So previously, if you were accredited under the SEPA program, it was providing evidence over a 5-year period. We've decided to reduce that to be in line with other accrediting organisations, so that individuals will need to upload evidence of engaging in professional development throughout the year. As I mentioned, this will be rolled out with the new website, as will our new accreditation categories as well. So if you are coming along to the conference in May, or even if you're not, you will then be given some information about the new accreditation streams that we'll be launching. So we will be rolling out an accreditation as a sport and exercise scientist. So those are for individuals who have undergraduate qualifications in sport and exercise science and can demonstrate experience working within that field. Not to the same extent as our current sports scientists who require to have those 200 days and a master's qualification, but we will have an entry-level accreditation. We're also rolling out specific accreditation for performance analysts as well. So look out for those at the conference in May, and also the professional development that will go along with those, which will be launched with our new website. So with that, I'd like to round out or finish off this particular part of the webinar and open it up for questions.
Great. Thanks very much for that, Kate. We have two questions already.
Mhm.
So the first one is from Ollie, and Ollie, it's great that you've joined us. And the question is, does the accreditation application need to be only within one discipline, or can it be across disciplines? For example, let's say biomechanics and skill acquisition.
Mhm. Very good question. And yes, you can gain you can gain accreditation with those two separate disciplines, but you would need to be able to show evidence of a master's qualification that covers both of those disciplines in sufficiency, and also that you have the work experience in each of those different disciplines. So, for example, if you hold a dual role, you would need to accumulate significant hours, that sort of 1,600 hours in both of those roles, to be able to gain that accreditation with a specialization in biomechanics and in skill acquisition. But it's absolutely possible.
Okay, great. Thank you. Next question is from a student who's currently in DCU, whereby they're studying an MSc in elite sport performance.
Mhm.
Would this course qualify for accreditation as a sports scientist with a specialization in strength and conditioning? Would they be able to meet the rest of the requirements?
Yeah, so it would depend on I'm not 100% sure of the exact outline of this particular degree, but if you do have a significant component of strength and conditioning within that degree, and you also have the relevant work experience within strength and conditioning, then that would make you eligible for accreditation. But if you only have, say, one module in strength and conditioning throughout that master's program, then that's probably not sufficient to gain you accreditation in that sports science strength and conditioning discipline.
Okay, great. A question from Wayne. Can the mentor or coach reference be people you work with or not?
Yes, they can be, absolutely. So you want people that can provide an honest and hopefully valuable opinion on your ability to work with athletes and also part of a team. And those references are submitted independently to the ISESA administrator. But you want people that you have worked with so that they can provide a true account of your experience in those environments.
Okay, great. Just to let the audience know, there's no other questions that have been put into our Q&A box, but this is the opportune time to ask Kate. You've got her. We've got her here. So if you do have any further questions, please pop them into the box. I suppose, what would you say, Kate, is the discerning fact between, let's say, some one that's at that higher end of the scale, 5, compared to a 3? Like, what do you see based on what you've observed and reviewed to date? Is that discerning factor?
Yeah, so some of the case studies that I've seen so far, when um, I guess the excellent ones, and I have the exemplars that we do have on the website, so those that have scored very highly in these categories, they may have shown a greater degree of understanding of the importance as working as part of a multidisciplinary team. And that's probably the area that most people don't articulate as well as they could. So we all know, working in sport, you don't work in a silo, that you work with other people, and you can't do your job as effectively as you could without other disciplines. So I think those applications that can demonstrate and explain how they've worked really well with strength and conditioning or psychology or nutrition or medical teams, for example, and what their specific role was in achieving specific goals for the athletes, they really stand out as being a more advanced practitioner. I think being able to let go that you don't know everything and that you need other people to help you is a true sign of a great sports scientist, I think.
Yeah, I tend to agree. Nice answer. Okay, we do have a question from Kate. If you're currently completing a PhD, for example, final year close to submission, is it appropriate to apply, but in this case, they don't have a master's degree?
Yes, so if you've passed your transfer assessments,
Okay.
then that would be deemed equivalent to a master's degree. So you can absolutely apply once you've passed that transfer.
Okay, great. There you go, Kate. Get ready for 1st of April.
Yep.
Um, a question from Laura. It's just over two questions here.
Mhm.
The hours of practice were at with high performance or elite. Uh, can you take GAA as an example
Yes.
with teams and the levels here, including women's games and what levels?
Yes, absolutely. And I guess GAA has come, a lot of the practitioners who have applied for sports science accreditation are working within GAA.
Mm.
And even though it is not classed as a professional sport here, it is really that high level elite sport within Ireland. So you can absolutely apply. And it would be great to see more practitioners working in women's sport. And we have had interest in accreditation from women's GAA teams wanting to employ accredited individuals and being able to seek funding to work with qualified individuals with their team, which is really promising that teams are reaching out to us to identify accredited practitioners to engage in their teams because they want quality working with their teams.
Yeah, that's great to hear. Next question from Aoife. What if someone was undertaking a structured PhD and didn't have a master's degree? Would that be eligible? Actually, you've answered that.
Yeah,
So,
stage
Aoife,
transfer again. Yeah. You just need
perfect.
to have that work experience as well. So make sure that if you've got the qualification ticked off, even if you've accumulated those hours working part-time over a series of years, you just need to make sure that you meet those requirements as well.
Just if the GAA question, could we just add a little bit to that? What a separate question's come through is that can it be applied in terms of underage as well, or senior
Yeah, it can
level,
be.
intercounty level only, or does
Yep,
it
it can
matter?
be. Yep, it can be employed. So it is where you've played a main role in developing those particular athletes to a high level, then yes. So GAA, I guess, is an exception to a lot of the professional sport rules, and it has been discussed and within the committee, and we do classify that as absolutely appropriate. If you're working with development teams that are achieving, working towards senior level teams and so forth, or development level athletes at a high level, you can absolutely include that. If you're working with the sort of under sixes, it doesn't really classify as working in high performance sport. But when you are in those professional settings, for development or senior teams, perfectly fine.
Not to say that working with the under sixes isn't equally as important, but
It is equally as important, different challenges.
yeah. Okay, we have a question from Aidan. Would another qualification such as the CSCS on top of the MSc in sport performance, which had a multidisciplinary approach to the modules, qualify?
Okay, I'll need some clarification what the CSCS is before I can answer
Yeah,
that
sure.
question.
I wonder, Aidan, if you could maybe pop that into the chat box or the Q&A box. We hopefully be able to answer that. But if we move on to the next
Yeah.
question, so this is from Cameron. Could we get an idea of the hours you would submit when working with a team? For example, if we've got 2 to 3 nights per week traveling on game day, how many hours in that week are we
Yeah.
actually submitting the entire time we're there? Question
No,
mark.
so you can't really claim hours sitting on a bus to travel.
Yeah.
They need to be actively engaging with the athletes, or the time that you spend doing administration for those athletes. So writing programs, developing plans, all those sorts of things can absolutely count it, but it needs to have that interaction. So if you're watching movies on the bus while you're traveling to a game, unfortunately, you cannot count those as professional experience. But if you are writing programs or developing plans while you're sitting on the bus, then you absolutely can.
Okay, so Tom Cummins is on the call. Hello, Tom, and he has clarified for us what the CSCS is. It is
Okay.
the NSCA accreditation for strength and conditioning coaches.
Great. Thanks, Tom. And so, Carla, can you just read that question out
Yes,
now
sure.
so
Yeah,
I've got
I'll go back
context?
to it. Okay, so would another qualification such as the CSCS, which is an American accreditation, on top of a master's in sports performance, which had a multidisciplinary approach to modules, would that also qualify?
Yes, that would. Now that I have context for that, so they would be applying for accreditation as a sports scientist with a specialization in strength and conditioning. And again, if you have the appropriate hours from work experience, then that meets those minimum requirements. Then you just need to develop that really well-structured case study.
Yep. I think you may have answered this, but it's coming from Brian O'Driscoll. I wonder if it's the rugby Brian O'Driscoll, perhaps. But anyway, it is. Does the 1,600 hours have to be in practical application of sports science skills, working in person with teams, or does research and preparation also count towards those hours?
Yeah, so I guess this is similar to
Yeah.
before. Yes, research and prep does count if you're trying to, like the sports nutrition example I gave, if you're trying to work out what is the current literature for trying to minimize muscle atrophy when somebody's going to be immobilized for 6 months, then yes, it is that you're furthering your education and developing your skill set by identifying the most currently available literature to help you help that athlete. So yes, it does.
Okay. Another question, going back to the PhD question, the relevant work experience working within higher performance sport, how long would that experience account for? So, for example, if this individual has experience working in a high performance environment 4 years ago, would that still count towards their experience?
It has to be within the last 5 years.
Okay, there you go, short and sweet. Thank you.
Mhm.
Um, a question from Craig. A sports science undergrad degree with an adapted physical education PhD. Would this fall into the category for accreditation in a sport role, sports science, when they do have work experience as a high performance within the GAA? So an undergrad degree focus rather than PhD specific.
I guess it just depends on the role that they have within the G. Is it like
Need.
a management role? Is it a strength and conditioning? Is it a specialization role that would fit our criteria? Um, I guess if it's physical, yeah, I'm not quite sure,
Yeah.
depending on the specialization of that particular individual.
Okay. All right. So
They want to,
that's
if they
as
want to pop back in the chat box
yeah,
what
exactly.
they're doing, that would be a good
If
start
you
to
want
help.
to, yeah, Craig, if you want to clarify that, that would be useful. And we have no further questions. So whilst we're hopefully waiting on Craig, or if anyone else wants to put a question in, Kate, you had mentioned about rolling out, more programs and the new website. And of course, go to the conference because that's where you're going to get most information.
Yeah.
So, do you have any kind of estimation of the timelines of when this is going to be released, or will it be at that conference?
Yeah, it will be. So the accreditation committee has been working really hard over the last
Mm,
12 to 14 months on developing an accreditation program for ISESA that aligns with some of the other big organizations around the world. So ISESA has joined the International Confederation for Sport and Exercise Science Practitioners. And so the aim of that is to try and make practitioners who are working in sport and exercise science more, their skills and qualifications more transferable globally. So practitioners in Australia can come and work here without having to go through the whole rigmarole of accreditation. And the aim is that vice versa, ICSA accredited individuals will be able to move to Australia or New Zealand or Canada, wherever that might be, and have their qualifications recognised. So we have a raft of different accreditation categories that we're working on, but the initial ones that we will be releasing in May will include that accreditation as a sport and exercise scientist, which is that entry level accreditation for those who have undergraduate or bachelor's degrees in sport and exercise science or similar areas, despite what the title might be called, and also the accreditation as a performance analyst because there's no accredited programs for those particular practitioners yet. And so we are in the very final stages of finalizing the scope of practice for these particular practitioners, with the aim of them being released at the conference, and also, the information and the documentation you'll be required to gain those accreditations, how you go through those accreditation processes. And eventually we aim to streamline them, more and more over the next few years. The idea, I guess, of our next challenge after we get this first accreditation level rolled out is to look more in the clinical exercise physiology domain as well, to expand the employment opportunities for people who have an interest in sport and exercise for health as well.
perfect. So the take-home message really is if you haven't registered to attend the conference, you need to do that, especially if you're interested in some of these accreditations. Isn't that right?
It will be, and we'll also have another webinar like this, but specifically for the that undergraduate accreditation level, because this was really purely for those more advanced practitioners, this particular accreditation. And the reason this one has been easily sort of rolled out is because we did inherit this from Sport Island. And so we have been working underneath their sort of accreditation program and adapting it a little bit. But we want more practitioners being able to be accredited with a national organisation so that we can build some momentum, gain that credibility, recognition within Ireland, so that when individuals apply for a job, we're hoping that ISESA accreditation will be one of the criteria, whether it's as an exercise scientist or a sports scientist or an advanced sports scientist, for example. So if you can't make the conference, then tune into a webinar after that conference where I will go through the same procedures again, but what you need to do to attain accreditation as a sport and exercise scientist or performance analyst.
Perfect. Great. Craig has clarified. So just going back, his question was about he has a sports science undergrad degree with an adapted physical education PhD. He's working high performance within the GAA, and he's clarified that his focus is strength and conditioning.
Yeah. So if you have those qualifications and you have significant experience in strength and conditioning, and your adapted physical education PhD has elements of the strength and conditioning plus your undergraduate, I don't see why that wouldn't be appropriate.
Yeah. Okay, great. Thanks for clarifying, Craig. Ollie's come back on again. What disciplines have approved accreditation routes?
For this accreditation stream, I'm assuming?
Yes, I'm
Yep.
assuming.
So the whole raft, we have sports psychology, sports nutrition, strength and conditioning, biomechanics, performance analysis. There'll be motor control in there. So I'm just trying to think if there's any others. Did I say performance analyst?
Yeah, you
I
did
think
earlier anyway.
yeah. So all of our mainstream accreditation or the mainstream disciplines, there's no cap, I guess, that we're not excluding anyone. We're more inclusive rather than exclusive. You just need to be able to demonstrate that it is a sports science discipline and that you have the appropriate experience in that discipline. They're the main categories that we have currently accredited, though.
Yeah, perfect. With that, Kate, we have no further questions, and I think you've covered a lot of questions today. Is there anything else that you'd like to say in relation to the accreditation before we close the session?
No, I think the main thing is to look at the ISESA website in the accreditation tab. All the templates, the guidelines, the exemplars are up there for you to review and to work through, and to start doing it now so you meet the 1st of April deadline. And then, because our aim is to turn those accreditation applications around as quick as we possibly can. So if everyone could get their applications in on time, they'll be out on the 2nd of April to our reviewers. So we can have a speedy turnaround. And if you have any questions, you can always email the info@isesa.ie email address, and myself or the ISESA administrator are at the end of that line so we can answer all your queries.
Perfect. And I know that your committee have been working really hard in this domain. So I suppose thank you very much for all your efforts in doing that. And thanks very much for coming today and giving us an overview and directing people and answering the questions. We really appreciate it.
No problem. I hope that helped everybody who is considering placing an application either this time round or maybe later in the year.
Sure. Yeah, I just got a few thanks coming in. So just to close our session, again, thanks everyone for joining in during lunchtime. Our next webinar is the 27th of March with Professor Michael Harrison, and he's going to discuss the National Competency, Qualification and Accreditation Framework for Long-Term Conditions Exercise Instructors. So we're still on the theme of accreditations. And as ever, check out our fantastic podcasts through Apple and Spotify and our blogs and all social media posts. Again, thanks again for everyone for joining us today. The sun is shining here. I hope it is shining where you are. So have a great rest of the day and get out and enjoy some of the sun when you can. Thanks, everyone. Bye-bye.